Are there cultural biases against men on testosterone treatment and the use of testosterone? We're going to discuss it after this, so keep watching. Hi, I'm Mike, the founder of Balance My Hormones, where we help men and women on their journey to optimal hormone balance. If you're new to the channel, please consider subscribing and leaving comments because we'll put them in future content. So today I'm here with a special guest and one of my friends, Kris, from First Man. Kris is an amazing YouTube channel that talks about kind of men's issues, dealing with masculinity and other topics that men of all ages deal with as we grow up through this changing society. So Kris, thanks for coming on my channel and having me on yours in this kind of collaboration.
Well, thank you for having me at my place.
Yeah,
It seems weird, it's like an oxymoron of a podcast, but it's very nice. It's different.
No, it's been, I just had to get out of my flat in London, come out to see you here in Cheltenham.
Yeah, of course you can.
Don't want people.
I thought this, I thought this before when I told people where I lived. I was like, oh no, people are going to show up. But luckily, I've been okay so far.
So, we had a nice discussion earlier on your channel, kind of all sorts of topics. And something that struck me yesterday is, as I've been the founder of Balance My Hormones and all the challenges and our own pharmacy, The Hormonist, there are many people who are very happy to see men getting treatment to fix their quality of life and their health through testosterone replacement therapy. But there are still so many biases that we've seen, and I wanted to get your perspective, as well as someone who's not on TRT, but someone who has a channel talking to men about men's issues, if you also see those same biases involved in this, just the use of testosterone and hormones.
Yeah, of course, all the time. Like very recently, obviously, I was talking to you about yesterday, I made a video on I'm potentially going to do TRT myself. And for somebody who's an avid natural, I love the fact that I'm natural and I've got my own supplement company. I'm not trying to plug them right there, but for somebody who's managed to get in shape naturally, put in the hard work, it's taken 4 or 5 years or so, and I've managed to achieve a body that I think it would be considered, by most men as something that they would want to chase after. I've then got to the point where I've kind of seen the guys that are above me, who are in like fantastic shape, they're absolutely jacked, they look unbelievable, their lives are like that tier above and whatnot. And I've thought, well, how can they get to that level? Because genetically and, with a sporting background, I'm pretty decorated in that sense, in football, boxing, athletics and whatnot. More so than these guys, and I think, well, my body's not at that level, and I've trained my arse off, if I can swear on the channel,
that's fine.
For 4 or 5 years straight, and I still don't look like these guys. So then you come to the conclusion, well, perhaps, they're using something. So I was saying to my audience that I'm potentially going to do a TRT cycle. Obviously I knew you were coming on, so we were going to discuss it. That was kind of before I knew that, like you said, once you're on it for life. Yeah. But, I kind of wanted to just blast it to a super, kind of physiological level.
That wouldn't be a TRT cycle.
No, it would be steroids.
Cycle.
Yeah.
And there can be repercussions of that, as I explained. My scenario, it's even going on TRT through a doctor at first, only to be taken off of it, the issues that arise from that. But
I like the disclaimer. It's very good. Yeah, you see my channel, I can see whatever I want. It's just a lot easier. But it's kind of like, I got to a point where I thought, okay, maybe I could do something. Maybe I could just even though I've got a supplement company, maybe my audience will let me off with this, Is it still a taboo? And obviously raising the question, I think it's the best kind of response I've ever had from something like this, or something that I've seen about this topic. Most guys who raise this, it's just 100% shit. That's what they get. I think because my audience trusts me, and obviously I've not made my mind up that I'm 100% going to do this yet. It was like a 50-50 split. 50% of the audience was still like, you're going to mess your body up. This is the worst thing that you can do. Why are you doing this? You're already in great shape. And one thing I've really been thinking about lately is, why do these kind of elite guys do it? Is it financial gain? Is it because they've got, negatives going on with their body, side effects that we don't know about? Their life looks perfect on the surface. They're a jacked guy, but maybe their penis doesn't work or something we don't know. But the other factor I thought is that, training becomes boring after a while. So if you've been training for 4 or 5 years and you've just kind of plateaued and you're not really getting any gains and you're only getting older, then there's a part of you that thinks, okay, well, if I take this stuff, the gym becomes fun again. You know, so that was like my way of thinking. But the taboo from the audience, it was still there. You know, a lot of people still saying, you shouldn't do this, you look great naturally, it's going to mess your body up, whatever. And I think it's almost, especially in the UK and the US, because that's my two main audiences, I think the main factor is that you've earned it. I think we've still got that thing in our brains as men where it's like you haven't cheated, you haven't gone outside. It's like having sex with a woman or paying for an escort.
Yeah.
Same thing, but completely different. The lads are going to come up to you, the boys, if you're American, you know, guys are listening, and they're going to be like, well done, you had sex last night, congratulations. If you go, it was an escort, I paid for it, they're like, oh. Do you know what I mean? It's not the same effect, is it? Yeah. So I think somewhat people look at it like that and think, okay, you've, you know, even though it's TRT and it's necessary, because obviously something's happened to you or your body or the environment around you has negatively impacted you, so it's only restoring what you once had, you know, which is very similar to something else that I'll bring on to in a minute. It's only restoring something you once had. It's not quite enhancing you as such, you know, but it's still that negative, like, TRT is so associated with steroids. As soon as I mention it, people always say steroids. It's like, but the two are different. That's why it's replacement. Replacement is the key word there, isn't it? It's replacing what you had before. And that was what was going to bring me on to hair and hair loss. Because this is something, this was massively taboo. If a guy had a wig, it was the worst thing ever. I remember I was on holiday, bit of comedy for you here. I was on holiday. And we were at this zoo and they were doing this falcon show and whatever. It'll all tie in. And this falcon was supposed to chase this fake rabbit or whatever. So the woman threw the rabbit, the falcon took off, swirled around, came in, like initiated what was supposed to be a kill, but it wasn't real. And then the falcon just kind of took off at one point, and it, like, as it flew down, it took this wig off this man's head. I mean, it's the funniest thing I've ever seen. And the whole audience were obviously like laughing and like pointing at this guy and whatever. And the taboo of having a wig for a man was just like end of the world. It was terrible. Oh my God, underneath there, you're bald. A woman can wear a wig and it doesn't mean anything, right? And I've seen over the last, I'm only 29, but I've seen over the last, like, let's say 10 years that I've been in this industry as such, hair transplants used to be laughed at. You know, if a guy said he's getting a hair transplant, it was like, what on earth is wrong with you? This is so weird. Whereas now, like, I myself have SMP, which is a head tattoo, and there's so many different treatments out there. There's so many different procedures that you can get. It's almost got to the point now where people go, why wouldn't you do it? You know, you've lost your hair. Why wouldn't you just replace it? It's that easy to do. I think testosterone, TRT, is going the same way. I think, yes, there's a taboo, but I think especially in the Western world, we're going, wait, hang on a minute. Your libido restores, your energy restores, your gym efforts obviously improve, your energy, your sleep. You go, why wouldn't you do it? Why? Nobody wants to get old. Nobody wants that lower back pain as they're getting older. Not saying it will cure that, but we all want to prevent it, whether that's skincare, whether it's hair, whether it's doing yoga to make sure that your body is, you know, more flexible, whether it's, you know, stop going on nights out and drinking alcohol and stop smoking cigarettes. Everybody's doing something. It's just TRT is just like it's a modern format of that, and I just don't think people are aware of it yet.
Well, not in this country. I think it's growing in the US, and you know, more to the point is who are the people that are creating this taboo around it, and we know it's partly coming from some in the scientific community, and they'll say, well, we just don't know the effects of testosterone long term, but we know because people have been on it for many years. The issue is when you get these approved, any drug that's approved is for a very narrow spectrum, a very narrow window of approval. So if you can hit that end point, you're good to go. You got approval for that medication, now you've got a marketing authorization. Mm-hmm. But because testosterone hits so many other aspects of one's life, more than just one symptom's improved, there are really no studies en masse like this, at least now to demonstrate for its efficacy. So that's, I think, where some doctors and some guidelines have a problem, of just putting people on testosterone, and by doing that, by restricting it from those who might need it, from actually getting it, it can cause this taboo or bias against testosterone. But it's not just testosterone, it also happens in the areas of thyroid hormones as well. because in the classical sense, you're either in or out. It's very binary. You're either hypothyroid or you're not hypothyroid. And there's kind of a new area called subclinical hypothyroid. So if you've got some of the symptoms that are related to low thyroid, lethargy, more tired, loss of eyebrows, which could also be from autoimmune disease tied to thyroid, higher cholesterol levels, depression. There's so many symptoms that may or may not be directly linked to thyroid, but also are linked to thyroid, but it could be linked to other diseases. And because the blood testing doesn't always show an exact number of what's in and what's out, some people are left not getting treated for many years because there's, again, a bias against any hormone. It's like this strange word. But I'm not afraid of that word because I've got balanced my hormones, and I named my pharmacy the Hormonist as a way to kind of bridge the gap and get people out to kind of understand that these are important medications that people need to have access to, and there shouldn't be a bias or a taboo against it. So anyway, those are some of my thoughts of why possibly that there could be bias.
It's quite interesting what you said, though. Are you saying that where doctors are quite reluctant to put people on hormone therapy, in the sense of maybe they look at it as, I'm not sure if you're quite right for it, and then that gets kind of misconstrued as, because it's risky, because it's bad for you?
Yeah, I mean, doctors want to minimize the risk to you. They want to do no harm, the Hippocratic Oath. And, you can applaud them for that.
Yeah.
But I think, as I said before, sometimes doing nothing is actually causing more harm. And so it's up to the independent doctor that wants to prescribe that. I'm saying there's a segment in the community, in the medical community, that haven't either seen the latest data or the studies on how TRT can improve. But I just want to say, like, going back to your case, if you don't need testosterone, if you don't have all the symptoms, this isn't going to just make you into a Superman and an Adonis, right? Yeah. So it's something that if you do need it, and of course that definition hasn't really fully been set or met, then yes, one should have the option of being able to, trial, but trial again assumes that it's going to be a short time. But someone needs to have that on offer, and then you should. Shouldn't carry any of the bias with it. But unfortunately, friends, family, the medical community, the media will demonize the hell out of testosterone. But estrogen, it's no problem. And it starts with even the legislation. Yeah. The legislation is Schedule 4, lowest level, but still scheduled on the controlled substance list in this country. That's really appalling, because we don't limit. I mean, it's bad enough with the supply chain issues on estrogel and estrogen for women, but the very nature of scheduling this drug and making it controlled. Why? Because men might abuse this testosterone. Okay, well, what does that mean, abuse? Are they grooming the testosterone and then abusing it, or are they? Sorry, I should say.
No,
but the point is, what defines abuse, and is this why there's taboo and bias against it?
See, this in a way reminds me of like driving insurance on cars, where men were charged more than women, and everybody was in uproar, and I was like, it's fine, what's the problem with it? Because men are more likely to crash because of testosterone and stuff like that. If we were to look at hormones, for example, estrogen and testosterone, if it was a beauty product, women would abuse it, as we're seeing with lip fillers and BBL and stuff like that. When it comes to hormones, and it's very gym related, it's very masculine related, I think men probably would abuse it. And I think that is where the taboo has come from. Because even myself, the difference between TRT and just pure testosterone,
or
steroid cycle, there's a massive blurred line. Because if you tell somebody you're getting on TRT, they would assume you're just getting on the steroid cycle. And if you said to somebody, I'm getting on testosterone, if you just used slightly different words and you didn't know what you were talking about, they would then say, oh, that's that TRT thing that so-and-so's on. Like, I think there's a massive blurred line, and that is where the taboo is coming from.
But not just taboo, but there's a bias against it to the point where the men who do need the treatment are being denied the treatment when that shouldn't be the case, and having difficulty accessing the treatment when they really do need it, because they're just, no, this isn't going to help, and they stick with some old notions, your prostate, your heart, etc. so which hasn't been borne out at all in the latest studies. I mean, it doesn't mean that it's harmless. You have to be monitored. You have to be cautious. The dose matters. Making sure that you do have a bona fide type of condition with symptoms to match the blood levels within a certain range, but not a narrow range, but one that we can measure with science. This has to be done to make it right. And unfortunately, I think there are some groups that can be very vocal and hostile about it. And I think it's because it's this niche area where people are, it's one of these topics. It's like, ooh, testosterone, ooh, hormones, ooh, kind of magical. Fairy dust, what does this do?
you think as a man as well, from that perspective, if a woman says I need to get on estrogen, it's very accepted that she's just getting older. It's very accepted, you can't talk about a woman's age. Yeah. Whereas a man is just an old man. You can't say an old woman. You're not, she's just not as young as she used to be. So you think to yourself from that perspective that, if somebody says, okay, I'm taking testosterone, the immediate thought is, your dick doesn't work anymore. You're having problems in the bedroom. You're not as masculine as you used to be. It's just openly saying those words, testosterone or TRT, or I need it. Just openly saying I require help is almost an attack on your masculinity, full stop. So from that other point of perspective, the doctors have got their own viewpoint on it, where they think everybody's got an agenda to take this stuff and use it for gym gains rather than, general health. But I think from the other point of view, that you've got almost like a social pressure, where it's like if you admit to your friends that you're not quite man enough and you need something to refill that, there's a negative connotation there.
So I guess that's a question, and some men will hide it. They'll be in the closet about their TRT.
Yeah.
They don't want their partners to know.
Yep.
They'll hide it from them and be very, very discreet about the whole thing. So in those situations, and maybe to your point about the masculinity and people think you're less of a man because you need this, then that's also to do in a bias related to testosterone and the fear that some men might have. So we respect everyone's point of view, being on testosterone. And I've always taken the approach, obviously, to come out about the testosterone treatment, because I think it's important as a men's health issue to make awareness about this issue and kind of lower the barriers, because you're right, women who go on HRT, and even the pill for that matter, there isn't a whole lot that gets checked. I think some of the guidance, they don't even ask for blood tests to start on the NHS. Privately, we offer different blood tests for women on menopause, because many women want to know, where they are with the FSHs, what the estradiol levels are. It also has to be timed with their cycle. But men, obviously, we have to have, by the requirements of the guidance, at least 2 blood tests taken at 2 different time points, sometimes 3 if we get contradictory information, so that we can ascertain whether, or the doctor can ascertain whether or not they're a good candidate for TRT along with their symptoms.
Do you think that's purely gym-based? Where they're thinking you're trying to get an enhancement here, like this guy's got an agenda?
I mean, maybe people think, like the person, from the patient's point of view, that can't quite accept that they need this. They don't want other people to think this is the case. But I mean, the thousands of patients that we've helped, there's legitimate reason for being on TRT, and we've seen a change in people's lives. Now, whether or not people who start, and we've seen people who start on testosterone treatment take up gym going, they take up exercise, they start this because they're trying to get their life back on a healthy, a healthy path, and this is kind of the impetus that they needed to get there, a bit of a fill-up to getting there.
There's a guy at my gym who's an old family friend, and now half the world knows who he is.
Oh, yeah.
I'm kidding.
Oh, yeah.
I've mentioned him on my channel as well, not by name. And I've known him since he was like 30, and he was always a fat guy, just working behind the bar, whatever. Like, I say fat guy, he was just like, he wasn't like obese or something like that. I'm talking like a normal overweight guy, not really in shape, out of shape, that sort of thing. I've gone back to the hometown in recent years, so like 15, 20 years later, he's closer to 50 now, or I think he maybe is 50, and he's jacked. He looks fantastic. Looks unbelievable. Looks about 20 years younger. So me and him got chatting and stuff, and we were just talking about like what he's done. He's like, I just love the gym. I'm back in it. It probably took him like 2 months to tell me, oh, well, actually, because I brought it up, he said, well, actually, I'm on TRT. He said, I've been taking it for like the last 5 years of my life. He said, I joined the gym. He said, best decision I've ever made. He was like, I look great. I feel great. He said, obviously, the wife loves it. And he said all of his friends are jealous. All of his friends, you know, but here's the thing. He was stood in the bar with them, having a beer, and he said, why don't you go to the gym? He was just talking to him. He's like, why don't you go to the gym? You'd love it. You know, doing this every weekend is not good for you. That's drinking, by the way, if people don't know British culture. I'm not doing anything else. And they said, yeah, but you're on steroids. And this is what, you know, all of them were like, yeah, but you're cheating, you're on steroids. So they weren't even counting it as merit. But if the guy's 50 years old, why would you not want to? I don't get it. Like, nobody leaves this world with a trophy for not taking anything. Do you know what I mean? And you think, if I'm going to be here 80, 90 years, I don't want the last 30 to be sat in an armchair, sipping on tea, watching Countdown. Like, that's my viewpoint. And I just think, I don't know why it's so frowned upon. If you can get to 50 years old and you're in great shape with a full head of hair, I don't know who that disadvantages. Maybe it's because there's a competition between all men. Maybe that's where it comes from. And then other men don't like seeing other men enhance themselves. You know, unless maybe it's a biological primitive thing that's built into us. It's like, if you're genetically better than me, I can handle that. But if you go and take something external, which is giving you that kind of ergogenic aid, so to speak, you know, if you were looking at it from a sporting sense, maybe we've got an issue with it. Do you know what I mean? I personally don't. I'm like a confident man who's comfortable with himself, but I think a lot of guys would feel inferior about that, as if you're getting an unfair advantage. Maybe that's where it comes from.
Possibly, it's kind of this arms race, and if
well,
if you know, you've got it, now the other people have to have it. But again, I suppose that's why in the medical community, or at least at clinics, there's a bit of a gatekeeper. You can't just walk into any pharmacy and get it off the shelf like you can the creatine. And it's probably for a good reason, because it's not to be taken lightly. You know, if someone doesn't know what they're doing and is self-medicating, or, you know, getting illicit steroids, you know, that can cause serious harm. You know, but when done properly, when done in the correct way, when done through the supervision of a doctor in a CQC registered clinic, then and that's in the UK, to be a clinic you have to be regulated and registered and interviewed and to run the clinic. So for America, you just have to be a doctor or a business person hiring in a doctor. So that's a difference. But in the UK, you know, if you've got that sort of supervision with the right clinic, then you know, it's something to enhance your health and fix the disease state. But you can't do it just on its own. As we've said many times before, you've got to look at it as a holistic approach. And if you can't get it right get your testosterone levels right at first with diet and exercise, you know, then testosterone is an option. All right, well, anything else you want to talk about?
No, that's perfect,
All right, so that was our video. Why don't you share with us your comments or any experiences that you've had relating to biases that you've experienced towards either your use of testosterone replacement therapy, and let us know in the comments below. But then, thanks for coming on the channel.
That's okay, it's my pleasure.
And it was a good topic, a good day. Also, don't forget to visit First Man, and I'll put the link in the channel so that you can look at all your content. You've got loads of content, and it's usually in a format similar to this. So it's very entertaining kind of podcast format. So again, don't forget to subscribe, and hopefully you like the video, and we'll see you next time. So thanks.